So, Assalamu alaikum, namaste, hello everyone, and a very warm welcome. Thank you all for joining us today for this important session, which is hosted by She Deserves Care. It is a community that is created to raise awareness and support women navigating through reproductive health challenges, but in particular, we are dealing with endometriosis. So since March is an endometriosis awareness month, and globally we have 1 in 10 women that live with this condition, and yet it takes 7 to 10 years seeking diagnosis, often being told that severe pain during periods is normal. So this is the reason why we have arranged this session with Dr. Madhu. I will be introducing Dr. Madhu in a while, but first I want to introduce She Deserves Care to all of you. And I would request if everyone can mute themselves so there is no disturbance. And
you're muted, Natasha, you got muted. Natasha, you're muted.
Okay. All right. Eamon, would you please record this session as well? And I really want to take permission from all of you that this session is going to be recorded. But if anybody does not want to appear on social media or don't want their name to be there on social media, please do let me know. And we'll not post your pictures or your name on our social media. So She Deserves Care, I'm the founder and the CEO of She Deserves Care. How it all started was when I would go to different gynecologists and I would have to hear, periods mein to dard hota hai na yaar, itna to bardasht karna padta hai being a woman. So like this pain was generalized to my gender. And I also start believing that yes, maybe this pain is normal. So I would just pop in painkillers. And that's the whole reason why I actually started this initiative, because I have this lived experience of endometriosis, which has disabled me in many functions of my life. So thank you so much everyone for joining in. We have Eamon Mubashir over here as well, who's my co-founder and CTO. She's my right hand and my left hand as well. And I don't think I'm able to operate without her. So thank you so much, Eamon, for managing the logistics and a lot of other things for She Deserves Care. I would like to show some images over here, which are probably not very graphic, because it doesn't show the maybe scars I have on my abdomen. It doesn't show the maybe burnt abdomen because of the severe heating pad I would use to get rid of the pain. But it still shows how one day before I would just live a normal life, and the next day I would have an endo flare and it would land me in the ER. Not even kidding. This is 1 in 10 women who suffers with this pain. The average diagnosis delay is 7 to 10 years. We still don't have a proper diagnosis tool, except for surgery to be sure about it, to be 100% sure about it. But I know that there are now doctors and endometriosis specialists who can figure it out, who can 99% be sure about endometriosis based on your ultrasound and MRIs. Then also, if you are living in debilitating pain, it's not normal. It's definitely not normal. So thank you so much everyone for joining in. I would like to formally introduce, and we are truly, truly, truly honored to be joined today by Dr. Madhu Bagaria, a board-certified OBGYN and internationally recognized endometriosis excision surgeon who is based in New York. She trained at the Mayo Clinic and has dedicated her career to treating women with complex pelvic pain and endometriosis using minimally invasive surgical techniques. Dr. Madhu, thank you so much for joining us and sharing your expertise with women from your community across different countries today. I would like you to formally introduce yourself as well, but before I move on, I have a few session guidelines, which I really want all of you to respect. One of them is to please keep yourself muted so there's no disturbance. Questions should be general and educational. Also, you can ask specific to your condition, but in a generalized way so that everybody is able to relate and understand. Please remain respectful toward the speakers and the participants, and we will try to answer as many questions as the time allows. Dr. Madhu, I want to pass on the mic to you if you would like to formally introduce yourself, and then we'll begin with the session.
Namaskar, walaikum assalam, and hello. So as Natasha told me, I am Madhu. You can call me Madhu here. My roots are in India. I trained there as well as in the US. And in the last, I worked as a general gynecology, as a gynecologist in the US. And there I saw this woman suffering with pelvic pain, infertility. And I was like, something is wrong here. And that's what I started looking into pelvic pain from a very different perspective. And that's how I got into pelvic pain, chronic pain, and into endometriosis world. And I was lucky enough to do a fellowship at Mayo Clinic. I was working at Mayo Clinic and very lucky to get into the fellowship and get trained by the world's best. There I saw like how endometriosis is affecting women so differently, and that kind of that was a light bulb moment for me, because I was seeing all these women, but I was not able to provide care. And now here I am after doing this fellowship. It was a worldwide open, like, you know, you're thinking about all these things and you're seeing the women. And now it's a very gratifying thing to see women who are enduring all this pain throughout the years. And now they feel so gratifying, so grateful that their pain has gone away and they're back to normal. The pain is no longer in their head and they're not being dismissed. So that kind of became a mission in life. And I myself, I feel like this is very important work being a woman. I feel very privileged to take care of women who's going through this silently. And it's my pleasure to be here, Natasha. You're muted.
Thank you so much, Dr. Madhu. Now let's formally begin with the session. We all have read through different definitions. Over here, you will find 80% of the audience who does know about endometriosis. But maybe if you can just quickly introduce what endometriosis is actually.
So endometriosis is a chronic inflammation. So it is a condition which causes a chronic inflammation. And the root cause of it is supposed to be some. So every month, and I can speak in Hindi, I just let me know. So every month, women menstruates, right? So there is a menstrual-like tissue in the uterus, but there are cells which is not exactly the menstrual tissue, but there are cells similar to the lining, which means that they respond to the hormones in the same way as your uterus responds. But instead of being in the uterus, वो uterus के बाहर होता है. And what happens with that chronic inflammation? जब आपका estrogen progesterone hormone आता है, तो these lesions they just proliferate, and then they can cause pain. They are near nerve endings. It causes a chronic inflammation state. It irritates your nerve. It causes a lot of blood vessels to grow, in that it वो burst होता है, फिर से regrow होता है, fibrosis होता है, inflammation और ज़्यादा होता है, and it recruits a lot of inflammatory cells like cytokines, IL-6, TNF alpha. All these things can cause a lot of inflammation. And this inflammation puts your body in a chronic inflammatory state, which can cause a lot of issues. Like it can affect from your brain, it can cause brain fog. It can affect your gut, can cause a lot of GI issues, but you're thinking that you're going to GI doctors for colonoscopies, endoscopy, because you're suffering from chronic constipation, diarrhea. It can cause urinary symptoms like frequency, urgency, and you're feeling that why I'm going to the bathroom so frequently, why I'm feeling so irritated, why my bladder is so painful. And you go to urologist and they put a camera inside your bladder and you don't have a diagnosis. And they give you this weird diagnosis, right? IBD, which is interstitial bowel disease, or interstitial cystitis. They give you all these weird names and you're like, something is wrong with me. Other things it can cause is painful periods. So the pain, some pain is normal, but the pain which debilitates you, you are thinking कि आज मुझे वहाँ जाना है कि नहीं जाना है, आज मैं क्या करूँगी, या फिर इतना कि तुम eating पैर लेके बैठना पड़ रहा है बार-बार fetal position में. This is not normal. Pain while pooping is not normal. These are like simple things which should not be there, but they are present. Then you start thinking in terms of endometriosis. So these tissues can be present everywhere. They can be in your bowel, bladder. It can be in your diaphragm. It can cause chest pain while breathing. It can be like any appendix, like they can cause bowel obstruction. So they can be present anywhere and can cause a lot of symptoms.
Thank you so much, Dr. Madhu. And as someone who has the lived experience, whatever you said makes complete sense, because I was not able to relate why why do I have to urine so frequently? That's not normal. Why do I have the sudden urge of going to the restroom, like very sudden? And then eventually I had a frozen pelvis and had to get the surgery done. But yes, some of the symptoms, if I walk through all of you, are heavy menstrual bleeding, like Dr. Madhu has highlighted. There's chronic pelvic pain that is involved, infertility, there's abdominal bloating and nausea. And these are some of the symptoms that are very evident and very noticeable. But the rest of the symptoms, like Dr. Madhu has highlighted, the brain fog, the depression associated with it, how hormones mess with your brain, that part of the symptoms is not probably studied well as well. I think, Dr. Madhu, you'll be able to comment better on the research part. If the effect that you have on your brain or your mood is studied well in relation to endometriosis.
So research does show that people who have endometriosis, because of their chronic inflammation, right, it affects your brain. The inflammation is affecting your brain and you're not able to think right. You're always in a state of exhaustion because your body is fighting through that inflammation. It's your whole body. Cells are trying to fight that, and that, like when you have fever, right? Your body, you have some infection and your body is trying to get rid of it. So your body works very hard. Imagine when you have fever, you feel so dull, you feel so fatigued, right? Same thing, you're in a chronic state like that. When you are having a chronic inflammation in the body is trying to get rid of inflammation. It's trying to work so hard. So you're always exhausted. You can't think right. All these things can happen. You can have back pain. You have people who have endometriosis, they also suffer, I see most of the time, they also suffer from migraines. Like these are the common associations which you see, the autoimmune conditions also, because they have some immunological thing which we have not figured out. Like what is that immunological thing which is off in their body? They have lower immunity or they cannot fight these cells, you know? So there is some immunological things also playing an important role, and all these cytokines which is released, the body's trying to fight it, can make you very tired, and brain fog can happen in those conditions. And there's enough to support it.
All right. Let's move to some myths versus realities of endometriosis. Have you ever encountered any, like, for example, for me, it was new to hear that if you have stage 4 endometriosis, you will have debilitating pain. You will have the maximum threshold of the pain. And if you have like stage 1 of endometriosis, you will have less pain. So do you think there's a correlation that exists over here?
Not at all. I will say that silent endometriosis is persists, and what is silent endometriosis? Which means that you have like a very bad case of endometriosis and you don't even know about it. And sometimes it comes to limelight because you're getting investigated for infertility. I had a patient who had such bad endometriosis that it was obstructing the ureter, which is the pipe which goes from the kidney to the bladder. So it kind of drains from the kidney, it drains to the bladder, right? So it is a pipe which connects. So if it gets obstructed, there's a backflow. So the urine cannot come from the kidney to the bladder. So there's a backflow in the kidney. And eventually the kidney, you lose your kidney. So we have had patients like that who don't even know and have such massive, like they have constriction of the ureter because of this pack of tissues encasing around the ureter and trying to constrict the ureter. We have had patients who have such severe endometriomas, which is chocolate cyst of the ovaries, carrying that and not knowing that they had endometriosis. And we have patients who have just a tiny, tiny bit like endometriosis, and they are in very pain. Like their pain is off the roof. So it never correlates with that.
So do you think it's where exactly is the endometriosis? That could depend on the level of pain. Like if you have it in the gut, you will have more pain or something like that.
Nothing like that. No.
Okay. All right. Any other myths versus realities that we all should be aware of?
You're asking me? I can tell you a lot.
Maybe 4 or 5, something that we all, yeah. need to
I
know.
would say, as a mother of a young daughter, I'll say that never ignore that teenagers can also have endometriosis. What I mean is that 13-year-olds, 14-year-olds can also have a very bad endometriosis, just because these endometriosis just can also arise when the child is in the womb, right? And when the epigenetic, when they get in the environment, some changes are happening and they can form it. And it has been demonstrated even in people who have not attained their menarche or their puberty. So even before their first menstrual cycle, it has been seen. So never ignore the pain in your teenagers. Having said so, I'm not saying कि बच्चे को period शुरू हुआ and उसको दर्द शुरू हुआ, you should start thinking of endometriosis. You can start with birth pills दे सकते हो एक बार, देखो उसको, like how is she doing, is she responding, how is she doing, you know. It's not that every person needs surgery, but you have to keep an eye on your daughters because they can also have severe form of endometriosis, and don't ignore the pain if they are complaining about it. And if it's affecting their life, you should go and talk to a specialist. This is one thing I can tell, because chronic pain in the end, like initially the pain, it also affects your brain, how your brain perceives the pain, and it causes central sensitization. So pain over a period of time becomes very centrally sensitized, which means that it forms a wiring in the brain, like from the pelvis, or any kind of pain movement, it kind of rewires your brain that you start thinking in terms of pain every time. So it's important that we don't go to that stage of central sensitization, where your brain starts, every movement of the body which should not be painful starts feeling as pain for them.
Yeah,
That
I think. Okay. I think you've raised a very important point over here that if anyone is having जिसकी भी यहाँ पे बेटियां हैं especially, तो या anyone cousins, they should be very very aware कि अगर उसको periods में इस तरह का pain है, that they are lying on the floor and not able to move, and they're not able to function a normal life during their menstrual cycle. That's not normal. It shouldn't ever be considered normal. So any other myths versus realities regarding endometriosis? And also, maybe I also want to understand the overlap of endometriosis and adenomyosis as well for the audience.
So if you talk about the overlap, so adenomyosis is basically endometriosis of the uterus, right? So endometriosis can be anywhere in the body, right? It can be in your diaphragm, which is it separates the rib cage from the belly. It can be in your bowels, bladder, anywhere around the ureter, anywhere. So when endometriosis is in the muscle of the uterus, it's called adenomyosis. It just have a special name. Like if you live on the 5th Street or 1st Street, they just have a different name, but they function the same. They're called evil sisters of each other. They're just sister conditions, which means that they're different locations and they behave in the same way. Adenomyosis specifically, because they are in the muscle of the uterus, it makes the uterus very, like whenever they undergo this inflammation and they undergo through this monthly changes, it makes the uterus sometimes enlarged and heavy. And these people can have more menstrual symptoms like heavy bleeding. You may not see that just with endometriosis. It mostly happens when you have adenomyosis with it. And endometriosis and adenomyosis can coexist get together in about 80% of the chances. Like people who have endo, 80% of the people can have adenomyosis and vice versa. So between them, and both these conditions can cause similar symptoms, except that adenomyosis can cause more menstrual symptoms. So sometimes when
like heavy bleeding,
yeah, and it can also cause other symptoms like bloating, back pain, painful intercourse. All these things can be caused by adenomyosis too, but more menstrual symptoms is caused by adeno.
Okay, all right. I would also like to let the audience, if you want to put it in the chat box, if you want to unmute yourself and ask any myths that you might consider, because there are few people who have confusion regarding whether they do have endometriosis या वो कुछ और है, उनको समझ नहीं आ रही है. अभी भी ऐसा सिचुएशन में मेरे पास काफी लोग आते हैं who say कि मुझे नहीं पता कि मुझे endometriosis है या नहीं है. So if anybody would like to ask any question, you can raise your hand at any point of the conversation. Or yeah, I would like to give a chance to everyone to speak up as well. Yeah, Madhu, please go ahead.
I just wanted to understand that. So, is it a condition that does start with like periods and from the uterus, or it can go beyond that? So, for somebody who may get their uterus removed, for example, do they get rid of this condition, or it still exists? Like, I just wanted to clear this confusion.
So it does not arise from the uterus. So one thing, it is a different condition, and if you just remove your uterus, it is not going to take care of your condition. So this is the condition, like some people are born with it. So what happens is that specific cells of their body may, and once you're in the environment, some environmental changes happen, some food, this is called epigenetics. When this happens, these tissues, they start proliferating and they start going through the changes, and that's how they form endometriotic-like cells. So some people have a propensity for it, and they just, it's like genetics, right? So it is like genetics, their genetic linkage to it as well. So if we just, it's not the, like it was thought before कि menstrual blood fallopian tube से जाके belly में आता है and उसी वजह से endometriosis होता है. But अभी पता है आपको that is not related to endometriosis. Endometriosis is a different animal in itself. It is not the cells which is shed from the uterus. So if you just remove the uterus, you're not taking care of the problem. And you should not remove it, especially if you're looking for fertility. Like if you go and like, oh, make endometriosis there, or but like let's take your uterus out, but they're not looking for these specific places where your endometriosis lesions are actually there, which can be the pelvis है, उसके side walls में curtain होता है, right? उस curtain में endometriosis रहता है. Uterus is connected to the rectum behind by uterosacral. That is the most common site of endometriosis. So if you don't tackle, or bladder में है, bowel में है, if you don't tackle those areas or don't remove those lesions from those areas, you're not taking care of your endometriosis. These lesions will still be there, even if you remove your uterus or the ovaries. You remove uterus, ovaries, but you'll still be in pain. So it's very important to remove these lesions completely.
Okay. Thank you so much. Mariam, you have a question as well?
Yes, hello.
Sorry to interrupt. अगर किसी को comfortable है उर्दू या हिंदी में बात करने में, तो please go ahead and ask your questions in that language as well. Dr. Madhu और मेरी जो connection हुई है ना, वो भी दुबई में जो है वो उर्दू और हिंदी पे connection हुई है. So if anybody is comfortable doing that, please do so. Yes, Mariam, sorry, go ahead.
Yeah, no problem. First of all, thank you so much for your invaluable information, all the invaluable information. Secondly, what I would like to know is that I have recently been diagnosed with endometriosis, and I had pain from the very first cycle. So I believe that I've always had it. I had very heavy bleeding, and it took me more than that to be diagnosed. So right now, every time I'm in pain, every cycle, I have this question on my mind because I've been diagnosed clinically. So I'm always worried that whether it's, actually endometriosis or could it be something else? Is there, as of right now, is there any way to find out without a laparoscopic procedure, up to even 80 or 90% certainty that a person has endometriosis?
Very good question, Mariam. So symptoms wise, just heavy periods or painful periods, like you're also connecting the dots, right? I don't know your full history, but bowel movements, bloating, all these things, they point towards endometriosis, right? With very certainty. The other thing is that ultrasound in the office or a clinical exam in the office or an MRI can also, especially if you have deep endometriosis like endometriomas or chocolate cyst, or yeah, for यूट्रोसेक्रल लिगामेंट जैसे में कुछ big nodules हो या bowel region में कुछ big nodules, you can easily pick it up on an MRI. So you know that even without laparoscopy that you have endometriosis. So sometimes, I always see patients in the clinic and I do an ultrasound myself. You kind of press on those regions, try to figure it out. So most of the time, I think 95 to 99% of the time, you can tell with certainty this is endometriosis.
Okay, all right, okay. Thank you.
Dr. Madhu, इसी से I would like to continue. Dolly, sorry, I'll come back to your उन्होंने भी chat box में एक question लिखा हुआ है. इसी से मरियम के question से I'll continue that ऐसा हो सकता है कभी कि like your ultrasound is normal, your MRI is also normal, but you still have endometriosis. The possibility is
100%.
Okay.
I have had multiple patients, like a patient मेरे पास आई थी. She was a celebrity in itself, and she was like, मेरा MRI clean hai, but Cesari symptoms was very suggestive of endometriosis, like periods में feverish feel karna. That is also because of adenomyosis, right? And she had endometriosis everywhere, like superficial disease, which means superficial disease मतलब क्या होता है? इसे आपने wall पे paint छिड़का, तो paint पूरे wall के अंदर नहीं जाएगा, right? It is just like a speck on. So that things cannot be picked up by MRI or ultrasound. But if you have something like a big blob, like nodules as a wall pe ho, so that can be picked up by MRI, because MRIs and ultrasound pick up those soft tissue masses, right? So if it is like little bigger, like more than 5 millimeter, then they can be picked up by MRI. And again, it is operator dependent. Sometimes I know Brazil with Dr. Abrao, they can also pick up superficial endometriosis. So it all depends on operator dependent as well. But it's very normal that ultrasound is normal, MRI is normal, but we still find endometriosis. We do see that. And this is not only in Pakistan or India or SA, even in US, like we see this condition all the time.
Okay. So I'll come back to Dolly ने एक यहाँ पे statement लिखी है. I would like to share that I used to have extreme back pain before the period and during the period. Even it's not possible for me to sit. Sleep many times. I feel headache, insomnia, heavy breathing, and many times irregular periods too. So again, I think Dolly is trying to ask कि क्या investigate करना चाहिए है उसे?
I think yes, you should, because back pain can be because of endometriosis in your uterosacral. Because imagine uterosacral is a ligament which goes from the uterus to your sacrum. Sacrum is your back, right? So if you have ligaments or if you have implants in those regions, it can definitely cause back pain too. I mean, look, some back pain, some pain is normal. I'm not saying that periods are totally painless. I'm not saying that. But if you are debilitated, you should definitely investigate and think in that direction.
Okay. A question here, Mohammed, if you can unmute yourself, can DIE exist without endometriosis?
So DIE, not deep infiltrating.
Yeah.
So it is a form of endometriosis, which is a severe form of endometriosis.
Severe form of endometriosis. ठीक है. So obviously you need to have endometriosis to have deep infiltrating endometriosis. Mohammed, please आप clarify कीजिएगा question if I'm able to understand that. अगर आप unmute करके पूछना चाहते हैं, please go ahead. Okay, it's okay. You can just write it down. अच्छा, कुछ questions हैं जो कि हमने registration form में Dr. Yes, please go ahead.
Hello.
जी.
We can hear you. Please go ahead.
जी मैं ये पूछना चाह रही थी कि डीपली इनफिल्ट्रेटिंग एंडोमेट्रियोसिस जो है वो एग्जिस्ट कर सकता है, मतलब आपके स्कैन्स क्लियर हैं, आपका अल्ट्रासाउंड क्लियर है, कोई चॉकलेट सिस्ट नहीं है, लेकिन उसके बावजूद ये पॉसिबल है कि आपको डीपली इनफिल्ट्रेटिंग एंडोमेट्रियोसिस हो?
Mohammed, it all depends upon कौन आपका MRI कर रहा है, कौन आपका अल्ट्रासाउंड कर रहा है, क्वालिटी ऑफ इमेजेस क्या है और कौन रीड कर रहा है. Because sometimes I get normal report, and when I see them myself, I pick up a deep nodule on the endometriosis. I have seen those situations as well. So most probably, like, if you have done in a very good place, somebody has read it very thoroughly, a good person, then most likely you may not have a DIE if your MRI is clear. But again, it all depends on who's doing it and who's reading it.
अच्छा, सॉरी मोहम्मद, आप कोई और क्वेश्चन पूछना चाहती है इससे, इसी से रेलेवेंट?
जी बिल्कुल, मैं ये पूछना चाहती हूँ कि यूजुअली जब पीरियड स्टार्ट होते हैं तो वो काफ़ी सारे लोगों के लिए पेनफुल होते हैं, लेकिन अगर पेन इतनी हो कि वो बिना पेन किलर्स के आप मैनेज कर सकते हो और उसके बाद जैसे जैसे टाइम गुजरता जाए आपकी पीरियड पेन्स ना होने के बराबर रह जाए और फिर सडनली जो है वो आपको पेल्विक पेन जो है वो आप एक्सपीरियंस करें ओव्यूलेशन के डेज में, और वो भी इतनी इंटेंस ना हो कि आपको मेडिसिन लेनी पड़े उसके लिए, तो क्या इसका मतलब ये हो सकता है कि एंडोमेट्रियोसिस का केस है ये?
Very good question. देखो, आप जो कह रहे हो कि पीरियड पेन शुरू हुआ पर इतना ज्यादा debilitating नहीं है, right? So some pain whenever you ovulate or whenever you're menstruating, body में prostaglandin produce होता है, and these prostaglandin can cause uterine cramps and that can be painful. So pain is normal during, some pain is normal during period and ovulation. But if that pain is not debilitating for you, don't have to think in terms of endometriosis, right? But again, silent endometriosis can exist. So endometriosis is not like cancer that you have to have a diagnosis and you need to have treatment. Everybody who's like, it all depends upon your quality of life. How are you managing the pain? What is happening with you? Like if it is causing you debilitating pain and if you feel it's not enough, this is not something you want to live, or it is causing you other things like bloating, constant constipation, diarrhea, nobody's able to figure it out, then you should start thinking in terms of endometriosis because these are quality of life issues too, right? Does that make sense, like what I'm saying?
मोहम्मद, आपने मजीद और कुछ पूछना है इसी से रेलेवेंट? आपकी और मेरी बात होती रहती है तो मुझे पता है आपका सवाल आगे इससे करेगा।
जी जी बिल्कुल, मैं ये पूछना चाह रही हूँ कि ये पॉसिबिलिटी है कि अगर आपके मतलब 2 सी सेक्शन मेरे हुए हैं तो ये पॉसिबिलिटी है कि मेरी पेन की वजह जो है वो सर्जिकल एडहेजन्स हो, एंडोमेट्रियोसिस ना हो, क्योंकि मैं भी बीच में हूँ कि मुझे समझ में नहीं आ रहा कि मैं किस तरफ जाऊँ।
Pain, Mohammed, if I ask you, because pain can have multiple generators. Yes, we are talking about endometriosis, but pain can also be arising from the pelvic floor muscles. That is something I feel that nobody's aware of it and nobody looks for it in MRI, and that can only be done during a clinic exam by palpating your pelvic floor muscles. You know, so I literally have to examine you. It can be from lesions, but what exactly is your pain? Mostly in the lower pelvis, back pain, चलने में दर्द होता है, painful intercourse होता है, क्या?
मैम बैक पेन है, इंटरकोर्स में भी पेन होती है, लेकिन अगर मतलब मूवमेंट रिलेटेड पेन है, अगर मैं मूव करूंगी तो मुझे पेन फील होगा और वो फ्लेयर अप हो जाती है ओव्यूलेशन के दिनों में, अदरवाइज पेन कम हो जाती है। लेकिन इसके साथ ही एक सिम्टम जो है वो मैं और ऑब्जर्व कर रही हूँ, वो जीआई ट्रैक से रिलेटेड है। उसमें ये है कि मुझे आफ्टर मील्स काफ़ी ज़्यादा जो है ना वो चेस्ट प्रेशर और बर्पिंग जो है ना वो होती है।
Look,
और ये ग्रेजुअली जो है ना, ये फर्स्टली सिर्फ पेन का इशू था, उसके बाद ये जीआई ट्रैक के जो सिम्टम्स हैं ये ग्रेजुअली जो है ये डेवलप हुए हैं।
what I would suggest, Mohammed, is समय like first of all, your pelvic floor needs to be examined. I don't know, Natasha, do you guys have pelvic floor therapist?
Not that I know of, but I will have to check. मोहम्मद, आपने भी काफी रिसर्च की हुई है। आई थिंक आपने मुझे जो शेयर किया था वो पेल्विक फ्लोर थेरेपी का ही तो नहीं था? वो जो एक थेरेपी, फिजिकल थेरेपी आपने शेयर की थी।
जी बिल्कुल, पेल्विक फ्लोर थेरेपी, मायोफेशियल रिलीज, बेसिकली एडहेजन्स को एड्रेस करने के लिए,
So not always
विजुअल मैनिपुलेशन, ये सारी।
Go ahead, sorry. Mohammed.
जी, तो ये सारी टेक्निक्स मैंने जो है वो मतलब इनके बारे में मैंने रिसर्च की थी, लेकिन ये मेनली जो है एडहेजन्स को डील करती हैं। एंडोमेट्रियोसिस के सिलसिले में मैंने अभी ये पढ़ा है कि डीसीए को जो है वो ट्रायल फेजेस में है इसके ट्रीटमेंट के लिए।
What is DCA?
Dichloroacetate.
Okay, I'm not aware of that.
Yeah, me too.
Yeah. So what I want to tell you, Mohammed, pain, तुम्हारे like when you're working on your muscles, right? कई बार जब मसाज कराते तो बोलते हैं ना massage therapist एक tender point है. कई बार ऐसा बोलते हैं, and then they put and they try to release that, right? It is not adhesion, but it is like a tender point in your muscle, right? Similarly, in pelvic floor, and again, this is because I had an interest in it and I wanted to do all these things, so I know it. Many people, and even in US, they don't pelvic floor muscles. And I have had patients who think they have endometriosis, and I just treat with pelvic floor therapy and sometimes Botox injections of the pelvic floor or lidocaine injections of the pelvic floor. And it really helps to relax the muscles and they feel 100% better. So I have to really examine you to know what is causing, what is driving your pain. Because when you have endured 2 children, women, they abuse the pelvic floor a lot. Like they have childbirth. Childbirth can also cause issues with the pelvic floor muscles, right? So when you have all these conditions, it can affect your pelvic floor, it can affect your pooping, like it can affect how you, like your painful bowel, painful intercourse. These all things can persist. Again, pain can be because of it. You can also look into other measures of pain as well. Everything cannot be a blanket statement in endometriosis also. But pain with movement, pain with
मैम एक्चुअली मैं काफी सारे
Sorry, मोहम्मद, आपके क्वेश्चंस पे हम मजीद और एंड पे आते हैं because we have a limited time left. We have some more questions that are remaining, so I would like to address them.
Thank you.
Yes, thank you. So एक हसन महमूद हैं जो कि मेरे भाई ही हैं, मुझे लग रहा है मेरे लिए ही पूछ रहे हैं. Once diagnosed, what are the best possible solutions and behavioral changes one should ensure to overcome? Also, stem cell therapy is an option. Stem cell therapy जो use हो रही होती है for this.
So when you are diagnosed, the first that you should go for excision surgery, which means that you're removing that inciting factors in the body, removing those inflammatory cells in the body to help. Most of the time, people do find relief with this just excision procedure. Lingering pain can be musculoskeletal. It can be other conditions like gut immune, which हो सकती है. बहुत सारे लोगों को MCS होती है, which is massive patient syndrome. So it all very active history taking to know your patients better. So, but if you are diagnosed, the best therapy for you, I mean, if you're not looking into surgery right now, you can start with the hormonal therapy to see if that helps you with the flare-ups and everything, but it's not going to take away your condition completely. Once you stop those, it will come back, right? So the best possible therapy is excision surgery, going for a complete excision.
Okay.
I have a question related to this. Can I ask?
Yes, please.
Yeah, I just wanted to ask, like, do we have a proper treatment yet, or we can just go ahead with surgery and hormonal therapy, and then we are back to step 1?
No, so there is a proper treatment. The gold standard treatment is excision. So you remove it. It's like when you have a diseased tissue, you want to remove the diseased tissue, right? So if you have like a mold or something which is growing and it is causing an issue, you want to remove that lesion first. So that is one of the first treatment options for you. The hormonal treatment, I don't say to everybody that you need hormonal therapy. This is a very personal decision. And the disease recurrence, which everybody's fearing about, it all depends upon the disease biology, like this type of disease phenotype. It all depends on that and what kind of surgery you had. So you're not, the recurrence rate is low in the hands of expert people is 50%. It also depends upon what kind of disease. If you had stage 1 minimal disease, the chances of recurrence is none. But if you are having like frozen pelvis, you have like endometrioma, because I'm not going to remove your whole ovary, those microscopic cells can still remain, which can still undergo your changes, and they can form recurrence of the disease. So most of the people, 85% of people, may not have any recurrence. The other thing is that lingering pain can be because of other causes, which is number 1, which I've seen in my practice, is musculoskeletal, which nobody takes care of it. Like nobody even looks for it, the pelvic floor muscles. And there is a huge, like people are very ignorant, even in US, about this pelvic floor muscles.
Okay, that's actually, I think, very new information for me, and I think most of us here. कि pelvic floor therapy भी हमने साथ we have to make sure that we are being we are being checked for our pelvic floor muscles as well. अच्छा, Dr. Madhu, एक और question है. So the question is basically कि, sorry, just a moment. Sorry. Does PCOS and endometriosis share any common origin? And I'm really sorry I'm taking so much of your time. हम कोशिश करेंगे कि हम 10 minutes में इसको wind up करें, and but you can see how many
I know
about this.
Yeah. So PCOS and endometriosis, they're two different separate entities. But a common background, your metabolic thing, which is like which we are doing with GLP-1, they can have a common thing, but they're totally two different separate entities, right? PCOS is painless, and it's mostly a state of metabolic condition, which means body makes hormonal imbalances, and our ovaries are not functioning properly, and mostly because of obesity की वजह से होता है, या insulin resistance की वजह से होता है. Even thinner people can have PCOS because of insulin resistance. So that is a triggering factor, and when that happens, it affects the ovaries, and the ovaries don't want to function. It doesn't want to ovulate, and that is what PCOS is. So it's a metabolic problem. When it comes to endometriosis, it's more of an inflammatory component to it, and it's more associated with pain. PCOS is only ovaries, and because of the anovulation, which is not, ovaries are not functioning properly, the uterus can have hyperplasia or abnormal cells, but endometriosis can affect any part of your body, and it's mostly with pain issues.
Okay, thank you. There is another question. Hi, my name is Eamon. Can we take medicine for pain? There is this myth that if you take painkillers, you won't stay fertile. I have always taken painkillers for the pain because it's so severe, and I'm suffering from infertility since 5 years. Is PCOS also a symptom of endometriosis? I think you have already addressed the second part of the question, but the first one regarding this myth again.
Always medication. It does not affect your fertility. Things do take pain. You cannot function. And again, understand that when you're in chronic pain, it alters your brain. So you don't want to be in pain.
Yeah. And you have to manage that pain because, again, the link between the brain cells and the pain, again, would be there. There's another question that does it also affect, can it cause ovulation issues in women, like having constant painkillers?
No, not usually. I mean, okay. When you're in pain, you should take pain medication. It doesn't affect that.
Yeah, there's this point that is written here that also, I think I also have this question. There's a medicine which is called Visane. Visane, yes. So they're saying this Visane now available.
Yes. It's a progesterone pill, right? Visane.
Yeah. Yes. It's said to reduce pain, but we don't know about it much. So
I'm just doing the salt. Okay. I think it's a progestin only. It's a combination pill. It's a Dynogest, yeah. It's a progestin. It's basically a progesterone. So whenever you have endometriosis, basically what they're trying to do is they're giving you this progesterone pills. So the more common ones are like Agestin, which is norethindrone. Some people use Dynogest, and some studies have shown that Dynogest works better. So it's basically the same class, but different. Like when you have GLP, there's semaglutide with retatrutide. So we have different forms. Similarly, it's similar to that.
So if I have progestin and I then quit it after, like I have a 6 months course or whatever that is, and then I quit. So again, the pain will be back, right? That's how it works.
Yeah. Once you started, there's nothing like a 6 months course. You should just, if you're having relief, just continue on it.
Continue. Okay. Does exercise help with the pain, particularly with endometriosis? If so, what type of exercise is preferred? Like ये भी बड़ा reels पे हमारे पास आ रहा होता है यार, strength training करना बहुत ज़रूरी है for people who have endometriosis. तो एक चीज़ जो मुझे पता है वो ये है कि आपने light रखना है, बहुत ज़्यादा exert नहीं करना अपने आप को. But what do you think about this question?
Any kind of movement is good for you, any kind of movement, but it doesn't mean that you have to exert yourself. Remember, your body is fighting an inflammation and you may be fatigued, right? So any kind of movement, it elevates your mood. Not necessarily it takes care of your endometriosis lesion, right? The other thing is that you don't have to do heavy core exercises, as Natasha is telling you. So for me, when I think of chronic pain, it's a way of debating, like when you do exercises, when you are in good community, when you're walking around, being in nature, it kind of helps to calm down your nervous system so you don't feel the pain. It activates the parasympathetic nervous system. It creates a good hormones in the body, right? And you feel euphoric. So it kind of helps to upregulate. So it helps to bring out your parasympathetic system to better form. And you want that because that is the nervous system for rest. The sympathetic system is always in a thing of fear, fight, flight. And when you are dead, it kind of perpetuates a cycle of pain. Any kind of movement which relaxes you, meditation, yoga, gentle exercises, being in nature, being with friends, family, sitting together, laughing together, enjoying a festival, these all things will help. Basically, it helps you clean down your flare-up.
We have another question from Mohammed. In a country like Pakistan, we don't have any specialist of endometriosis. What should we do as endo exhibit different symptoms in different patients? So Mohammed, I think I would like to answer this. This is what we are doing. Dr. Madhu is helping us. There is no border right now. There is nobody who is in US or in India or in Pakistan. We are here to support each other. Jitna help ho sakti hai, hum kar rahe hain. But yes, we do need endometriosis specialists in Pakistan. But agar aap, Dr. Madhu, isme kuch add karna chahti hain, please go ahead. I have a few more questions.
Look, I know cost becomes a major issue, right? But I'm happy to take care of you guys if you're going to come here. I don't know. I know this is the global access thing is not only for Pakistan or India. Trust me, in Europe also is having the same issue. US is also having the same issues. There are only like a handful of specialists in US, like only 100 physicians in US as well. And we get patients from Canada. Canada is having the same issues. Canadians don't get a good healthcare. We get patients from London, Norway. We get patients from everywhere. So
Okay.
I hope in future by spreading awareness and people specializing, I hope that this bridge can be shortened. And if a gynecologist want to come to train under us, more than happy to train them.
Okay. That would be really, really nice because we are looking for gynecologists who just do not want to have another C-section and deliver a baby. We want gynecologists who are there to support us, who are there to have specialization in endometriosis and fix our problems, or at least reduce our level of pain. So that's really generous of you, Dr. Madhu. So we have another 6 minutes and I'll try to wind up. We have a lot of questions, but if some of them are remaining, I'll just message you, and if you have any input, you can just let me know. But I'll just take 2 more questions. A participant asked whether endometriosis can cause pain in the hips and legs, and what other pain management option exist when commonly prescribed medications like Motrin that do not have sufficient relief. I don't know what this medicine is, but it's that's the question. I know that hips and legs are definitely involved. There are people who have sciatica with it as well because of endometriosis. So,
Again, Tasha, having said so, I don't want to tell everybody that anything which happens with the hips or back is already endometriosis. I don't want to spread that message. Some of the hip pain, back pain can be related to endometriosis. Again, that's why a good history is important. The other thing, coming back to pelvic floor muscles, somebody needs to also examine your back, make sure that there's no definite hip pathology like labral tear or specific hip thing which is causing you driving the pain, or pelvic floor tightness is driving the pain, because that pelvic floor muscles can cause a lot of pain in your back. It can cause a pain in your pelvic region, groin region. So making sure that these are also addressed. For me, I always examine the pelvic floor muscles of my patients, and if needed, I also do suppositories like Valium. You do get Valium tablets in Pakistan, right? So sometimes you can put those Valium tablets inside the vagina. to see if that relaxes the pelvic floor. You can use muscle relaxers. And again, pelvic floor therapy. And sometimes if I need, I will also do Botox injection of the pelvic floor, or and lidocaine injections, which is lidocaine is a numbing medicine.
ठीक है. एक और question है regarding GLP therapies, and if somebody is trying to conceive and they want to improve their chances with IVF, तो वो क्या कर सकते हैं उसके लिए? Is there any like checklist that they should follow, or कुछ like what should they do about it?
GLP and IVF, or with IVF, first of all, if you are looking for it, I would definitely say that you should make sure that you're not having endometriosis, because IVF itself, going to the IVF and going to this is very expensive, and it's emotionally and financially very expensive. And I think emotional parts are the right? The second important thing is that making sure that your egg qualities are good. So if you have, check your hemoglobin A1C, and if your hemoglobin A1C is more than 5.3, then either start metformin or even a GLP will help, because it helps with the egg quality, because it helps to, the metabolic pathways reverse, like something they do which helps to help you to have better egg quality, because that would be very, very beneficial for people. But again, once you get pregnant, you can stop your GLP-1s and everything. I don't know, like it's a very broad question. I don't know if I'm hitting it or not. Like, what's specific information you want?
ठीक है, makes sense. Like you are saying that HbA1c test करें, और अगर वो 5 above है, तो you go for the meds.
Even though you're not diabetic, it's not for diabetes, it's not for things, it's for your egg quality and for you to conceive.
Okay, ठीक है. एक और medicine है डॉक्टर मधु, NAC जिसको कहते हैं, N-acetylcysteine or something like that. वो भी आजकल बहुत viral हुई हुई है, और जब मैंने मंगाने की ट्राई की तो उसमें लिखा हुआ आ रहा था कि for whitening complexion, which was weird. But
understand, these are all anti-inflammatory thing. It's basically a precursor for glutathione. NAC is basically glutathione, right? And it's antioxidant, anti-inflammatory. And when some research has shown that it reduces the flare-up, it reduces painful cycles, it reduces the size of endometrium. So basically, these are all anti-inflammatory tissue things. But again, one thing doesn't fit for everybody. Like everybody may not like GLP-1 or things. So it's just a trial and error. Like LDN, which is low dose naltrexone, is also like people with inflammation flare, they're taking LDN, which is low dose naltrexone, even when they're trying for infertility. But again, it's not like one thing fits for everybody. It's like trial and error, because some people feel great on LDN, some people don't. Some people feel great on NAC, but some people don't.
I think I'll take one last question, क्योंकि ये मेरे लिए भी बहुत important है, कि are there any foods that I know we don't know about the causes part of endometriosis, it is genetic or whatever that is, but कुछ चीजें हैं जैसे red meat का बोला जाता है कि उसको avoid करे. There was this research I was reading, NIH की थी, उसमें था कि dairy products जो consume कर रहे थे उनका बेहतर था. That was new for me. तो मुझे नहीं पता कि like कोई ऐसा फूड आप रिकमेंड करती हैं कि वो हमें नहीं अवॉइड करना चाहिए है, प्रोटीन ज्यादा गोश्त की फॉर्म में, मीट की फॉर्म में अवॉइड करना चाहिए है. तो any suggestion that you would like to make in this, and this would be my last question to you.
For me, I think that you should only avoid processed food. Any kind of processed food which comes in a packet, always eat from your home. Red meat, yes, you should avoid red meat, alcohol, except because of the estrogen content. They tell you not to take all those stuff. But for me, like people say gluten-free diet. For me, if you feel okay on gluten, you can continue on it. I'm not against gluten or dairy-free. Go gluten-free, go dairy-free. Especially if it's not causing you. So listen to your body, stay in tune with your body. But the only thing which I say is avoid any kind of processed food, because anything which comes in a package with all those chemicals in the back, you know it's a gluten or it is the product in that specific thing in that packet which is causing you to flare up. So eat clean, eat from your home, eat from your kitchen, and avoid those meats and all. Yeah, everybody knows they need to avoid those things. But I'm not so much against gluten or dairy. I feel like you can try to eliminate it and see how you feel. If you don't feel a difference in about a month or two, then you can go back to it. Like, but and again, in moderation.
Yeah. Whenever I have done a gluten-free diet, I've got really, really constipated, and my abdomen and pelvis would be on fire.
This
And
is
then
typically different than other Western people too, right? Like everything is not like we are a little different. Like we're similar, but we are different.
definitely, yes. So, thank you so much, Dr. Madhu, for sharing your knowledge and insights with us today. Your work is helping us, many women, and I don't know how to thank you enough for taking out
It's my
time
pleasure.
in such a busy schedule. And I don't know how I landed to just meet you. And I think you are just an angel sent by the God for all of us. So thank you so much for all the efforts you are doing. और अगर there's कोई हेल्प आप प्रोवाइड कर सकती हो, जैसे कि यहाँ पे एक दो हैं लोग जिनको बहुत ज़्यादा लाइक दे आर वेरी वेरी कंफ्यूज, और मुझे काफ़ी लोग मैसेजेस करते हैं, तो अगर हो सके मैं आपको कांटेक्ट करूंगी फॉर दैट. अगर आप उनकी किसी भी फॉर्म में हेल्प कर सके तो दैट वुड बी रियली रियली गुड फॉर ऑल ऑफ अस. सो thank you so much, and any message you would like to give to all these women before we all exit?
No, I think being a woman is a privilege, and I know that when women goes through it and nobody is listening to them, I think you guys are doing great. I always tell women that pat yourself always in the back because nobody else pats you.
Okay. Yeah, true.
You're a great
That's
job.
right.
All right.
Much
Thank
great.
you. Thank you. Take care. Bye. Thank you everyone for joining in.
Thank you, Dr. Madhu. Thank you, Natasha.
Thank you.